José Antonio Ruiz-Postigo from the World Health Organization. I work at the Global Neglected Tropical Diseases Program, and I would like to thank the organizers of this event for having invited me. WHO published a couple of years ago a new roadmap for neglected tropical diseases, the so-called 2021-2030, where you will find cross-cutting targets and disease-specific targets and indicators. The cross-cutting target for skin-neglected tropical diseases is a general one, and it reads number of countries that adopt and implement integrated skin NTD strategies. If you look at the target at the end of the 10 years, we hope that at least 20% of the countries worldwide would have adopted an integrated approach. If we look now more in detail about the 9 diseases or group of diseases called skin-neglected tropical diseases, you will see that there is 1 targeted for eradication, EOS, 3 for elimination, leprosy, onchocerciasis, and lymphatic filariasis, and the rest targeted for control. In the document, you will find precise targets, indicators, and the milestones. But where are those diseases? If you look at this map, you will realize that in the tropics, at least 5 or 6 diseases of these NTDs are co-endemic and coexist in a given nation. Last year, we went a step forward and we published the WHO Strategic Framework for Integrated Control and Management of Skin-Related Neglected Tropical Diseases. But so far, I have been talking and mentioning neglected tropical diseases. But the reality in the field, if we go to the day-to-day to a clinic, we will realize that skin NTDs are barely 10% or less of the diseases that a clinician will find in the day-to-day. And who is going to see those diseases? Who is going to see those patients? Well, in the tropics, diagnostic and treatment is basically done by non-specialists, nurses or community health workers. And in high-income countries, I think we have now a current crisis in general practitioners and dermatologists, which for us is considered the gold standard, but there are not enough GPs and certainly not enough dermatologists in the world to help with skin diseases. So what is next? We have an answer to that approach in the WHO framework. If we look at the goal, if we look at this house, if we look at the roof, the framework talks about skin health. It doesn't talk about a specific group of diseases, and it mentions for all, meaning that we should not only address the needs of people living in the tropics. More importantly, working for the Tropical Disease Program, this strategy also emphasizes that we should pay attention not only to the tropical diseases, but also to other skin conditions. And here is an algorithm that I invite you to reflect on it over the day. It's an algorithm proposed to augment human capacities for capacity building in dermatology. So the first thing we need for clinicians is for them to have proper training. So let's now imagine a situation where internet is not available. It still happens in many parts of the world. So how do we do capacity building without internet? We'll rely on printouts, or maybe with a USB key, we will do presentations in the field. and then we have to do hands-on training with real patients. But internet is available in many countries, even in the tropics. So what can we use to train staff in a place where there is internet? First, we could use online courses or online resources, like the WHO channel for online courses, like DermNet, like Global Dermatology. There are plenty of resources. We could also use a skin app with algorithms, either based on artificial intelligence or image recognition or logical algorithms, and then again coupled with hands-on training. After that, we should ask ourselves or ask that colleague, did your knowledge or the use of that app allow you to do the correct diagnosis and treatment? If the answer is yes, well, problem solved. You go and treat the patient, and then you report the case in the national surveillance system. If the answer is no, then maybe we can go to another step further and use teledermatology or refer the patient. So after this slide, 3 questions for you. The first is, what do you think? Do you agree with that symbiosis between the dermatologist, the gold standard, the AI, and teledermatology? If you agree, why is it being so difficult for most of us to obtain photographs to train and validate AI algorithms? And the third, since I'm coming from WHO, I'm asking you, what do you think should be WHO's role to improve skin health worldwide? We value your expertise at WHO. We count on what you know, your time. So we have a roster of experts where you are invited to register so that when we call for meetings or we need expert advice, we can find your contact. I hope we can discuss this week here, and if not, after this meeting, that is my email. Thank you.